Good afternoon. Thank you for joining us today for this webinar. My name is Frank Moceri. I'm a physical therapist with Mercer-Bucks Orthopedics. I have been practicing in the orthopedic realm for about 30 years at this point in time, and I have had a great interest in dealing with youth athletes, both in the coaching arena and as a physical therapist. I've been dealing in prevention and or managing of injuries for quite some time. So I'd like to get into how to prepare these athletes to either return to sport after an injury and after a off-season layoff. So as you can see, most of the baseball players in the United States are under the age of 18 years old. You have 2.5 million players in the US, 99% of those are youth or high school baseball. So therefore, most of this discussion will pertain to the youth athlete because they are the abundance of the athletes we're going to see. There was a study by the American Journal of Sports Medicine where 50% of the 9 to 14-year-olds have experienced elbow and or shoulder pain during play. The problem there is that most of these children will not let an adult know that they are experiencing these pains. They won't tell their parents for fear of not being able to play, and they won't tell their coaches for the same reason. What you can see next is that 61% of all these injuries are to pitchers. So a predominance of what we talk about is going to pertain to pitchers, but the throwing motion and the requirements to do that are important to all baseball players in general. Overhead throwing requires strength, coordination, muscle balance, flexibility. There's many things that go into throwing a baseball with efficiency. There are a number of risk factors that will lead to injuries. Number one is fatigue, just the player not being conditioned enough to complete the act of throwing the baseball for a baseball game. One of the main things we see is that young athletes are throwing too many innings in a game, too many pitches in a game, too many games per week. Year-round competition is probably one of the biggest problems we see nowadays. With the advent of youth travel baseball, there's some children are playing between 90 to 130 games a season. And oftentimes, kids that pitch are pitching on both their travel team and their house team, not getting the proper rest in between sessions, not doing any conditioning whatsoever other than maybe a little bit of throwing on the side, maybe some stretching, but nothing that prepares them for the physicality needed to be a pitcher. Next, we get into mechanics, the ability to maintain balance, to generate the forces to throw that baseball. The mechanics themselves are what makes the pitcher be able to throw with velocity, avoid injury, and recovery from the throwing process. Poor conditioning would include inadequate range of motion or at times excessive range of motion. With excessive range of motion, the joint itself may be too loose and the pitcher may have dislocating areas of the shoulder, which eventually lead to labral tearing, etc. Weakness, decreased endurance, and decreased stability of the shoulder. We have a term that you'll read about and you'll see, and oftentimes if your athlete has been injured and they see a physician, they will get a diagnosis of GERD. It is glenohumeral internal rotation deficit. Sometimes this is the inability to internally rotate your shoulder. Oftentimes it's just happens from the act of throwing over and over again. Your bones develop in a way that limit that. Also at times the back end of the shoulder is weak and it gets tight and weak and there's an imbalance there. And again, you lose some of that internal rotation. Probably more important just than the loss of internal rotation in injury prevention is that the total range of motion of internal rotation and externally rotating the shoulder becomes more of a guideline as to what you should be looking for. Say the throwing shoulder has a total range of motion of say 160 degrees, you would want the other shoulder to be the same, even though internal and external rotation may have differences. How to avoid risk factors? Well, every time a pitcher throws, not every pitch should be 100%. They have to work on command, location. Velocity is an important part, but not every pitch has to be 90 miles an hour, so to speak. Probably the most important things, and we'll reiterate this a few times, is that the player should not be competitively throwing all year round. They should have at least 3 to 4 months of rest. Some studies show that the injury risk of playing year round goes up 5 times without that 3-4 months of rest. Doesn't mean that you can't throw, you can't have a catch, but competitively throwing, it's a must that you shut down the athlete. We must continue to try to maintain our range of motion and strength and shoulder stability throughout the season, which means that you can work out during the season, but as we'll talk about later, there's a time and place for each type of exercise and the volume that you may perform while you're doing these things. Excuse me a second. Also, the athlete should consider getting a professional review of his pitching mechanics. Mechanics are very important to set up everything from the foot on the ground all the way to the shoulder and hand and the release of the ball. Some of the actual review of pitching can be done with cameras and more at a pitching type clinic, as opposed to what I'll talk about later, getting a review of the physical systems. And here in my next slide, you can see we're talking about a preseason screening. So what you would do is you would go to a professional like myself or an orthopedic physician and get a preseason screening, not wait till you get hurt to see what's wrong. It's good to get an assessment of the range of motion, how the joint moves, whether it be the shoulder, the elbow, the wrist, the core muscles, the lower extremities, etc. We also want to assess the posture and the scapula position. The scapula are the shoulder blades. There's always going to be a little imbalance because the dominant arm that scapula is going to be in a little different position than the non-dominant or non-throwing arm. We want to have an upright posture. We want to have good range of motion in the thoracic spine. Oftentimes, most of the patients that have problems and most of the people I see have a forward slumped posture where their head is forward, the shoulders are rounded in, and this itself will lead to some injuries. But again, getting an assessment by a physician, sports physical therapist, or other throwing professionals is highly recommended, especially preseason. And unfortunately with this COVID pandemic, a lot of athletes are just getting out there and playing right now. And unfortunately, we're seeing a higher number of injuries than we normally would see at this point in time. Usually we start seeing them as the season goes on and the athletes fatigue. If you have been injured or it is preseason and you haven't been injured, number one, and most importantly, is you want no pain or swelling at any of the joints, and especially at the shoulder or the elbow. You want to make sure that, as we talked about earlier, you have the adequate range of motion to complete the process of throwing a baseball. And we could even go as far as to hitting. That obviously requires all the same things, but different muscle balances, et cetera. And we're not doing a hitting discussion, but it's important for all athletes to train, long story short. We want to get that baseline strength. What we would assess is different points of the range of motion. We would do some manual muscle testing. We would do some exercises to the point of fatigue and see that the patient, I want to keep saying patient, the athlete is strong on both sides of the body and meets that baseline strength. Oftentimes I will test a young person who comes in and they already have weakness in different areas of the body. So if they were a professional and they went to the trainer and they did the same test I'm doing, they would not even be allowed to compete. Yet most of these athletes are still competing on a regular basis. They would have to shut it down, get into a program, work up to a throwing program, et cetera, et cetera. Oftentimes in the amateur athlete, you do not see this, especially, in the sub-high school age. We want to be able to do plyometric strengthening, which is more explosive energy strengthening. We'll get into that a little bit further as we go into the discussion, but plyometrics involves medicine balls, jumping, squat jumping, etc. An interval throwing program is a predetermined amount of throws from different distances. There are different programs for youth baseball as opposed to the teenage athlete who's a little bit more mature. His throwing program goes with a little bit more distance, not so much the amount of throws, but the distances that they do throw. Also, if it was a pitcher, they go through a regular throwing program on flat ground before they would even be able to go on a mound. And then there's a whole mound program, which we will not get into today, but all of these things can be found within the online community. Oftentimes I'll go to different universities and professional websites to see what throwing programs they use, and 99% of them are the exact same program, just gives you a place where you can go and print some of these things out if you just wanted to look at it. But I would definitely seek professional interpretation of these things before you start doing on your own. As we talked about, mechanic assessment, but most of all, we want pain-free competition. I'm going to go through some basic anatomy. I'm not going to get into an anatomy class. This is looking at the shoulder, the scapula, the clavicle, and its various bones, so to speak. You can see the rotator cuff musculature at the very top, but that is only one of the muscles. You can see the collarbone, the acromioclavicular joint, which I can't point to. Unfortunately, I don't have a pointer at the very tip of the shoulder. Oftentimes, the humerus, which is the long bone, will get caught under those bones. So getting the synchronicity of the muscles, and as you can see when I go to the muscle slide, that shoulder becomes much more complicated. You can see all the rotator cuff muscles other than the front side of the body. There's the subscapularis is not shown here. And you also see your lats or latissimus muscles. You see your trapezius muscles. You see some of the core muscles from the back end. It's obvious a very complicated situation for just our regular movement, let alone athletic movements. Here's a quick shot of the core musculature. Most people just think of their six-pack, but there's many layers of muscles and different angles of muscles that work on rotation of the spine and rotation of the body to propel that baseball. Here is a picture of the lower extremities, and briefly, again, you can see there's numerous muscles, flexibility, strength, coordination of these muscles, again, is what we need to work on, and we need to make sure that the range of motion is adequate and the strength is adequate. Balance is also an important issue, usually balance from the core. The core acts as the foundation of the body. If the core is not strong, all our movements are going to be altered. If we're not balanced in the center, our body may lean one way or another, putting undue stress on various parts of the body. This is a quick diagram of the pitching phases. All throwers go through these phases, not all in the most efficient way. The windup briefly is just getting to the balance point. The early cocking, you're getting a little hip rotation, a little trunk rotation, you're loading the body up. The late cocking is you're starting to get into the arm into position to throw. As you can see, there's external rotation, the thoracic extension, weight on the front foot, everything getting in to propel that ball forward. The body comes through, the ball is released, and the follow through, all the muscles on the posterior back end of the body act as decelerators. In a real visual way, those muscles may keep the arm from flying out of the socket, so to speak. So if they're not strong, you're going to get little tiny traumas that will lead to problems later on. This next slide is a very busy slide that talks about each phase of the mechanics. The windup, as it says, is getting to the balance point. the early cocking. What's most important about that is you can see there are a number of structures that come into play. You have trunk rotation, you have the shoulder, you have the elbow, you have the foot. Where it lands is important, which means that your hips have to be flexible enough to get into a proper position. In the late cocking phase, you need maximum external rotation. You'll see professional athletes. I've seen pictures, still photos of a guy like Chris Sale. He gets his arm back 180 degrees. Most people we see in the clinic, just normal people, we're happy to get 90 degrees. A pitcher that's going to throw that ball 90, 95 miles an hour needs maximum external rotation. The scapular retraction is basically the squeezing of the shoulder blades is a fancy term. I mean, the retraction is a fancy term of the shoulders squeezing together, but they position the long bone of the arm onto the shoulder blade so that it's balanced. There's a great deal of stress on that capsule. If we're not strong in the posterior capsule of the shoulder, oftentimes it will lead to shoulder, and more often I see is elbow injuries. The Tommy John is just on the upswing. More and more young people are having to undergo Tommy John surgery. Everybody thinks if you get that surgery, you're going to come back. Some people believe you're going to come back better. Not always the case. It's probably an 86% return to throwing, but oftentimes there's not a number, but the estimation is that 40, 50% of them get back to where they were, especially the non-professional athlete. When you're accelerating, meaning actually throwing that ball, that arm is traveling at 7,000 degrees per second. You don't have to be a physicist to realize that's a very quick motion. That's a very quick velocity. And all of a sudden, all of that has to be controlled by the muscles in the back of the shoulder to slow that arm down. A good follow through involves getting your chest over the front leg, get your back leg off the ground, again, to dissipate all those forces that we talked about. You can do a whole session just on forces. I know we are doing this more for the lay person, not the professionals. So I'll get away from this slide. Sorry for rambling. Some of the risk of poor mechanics, tightness and weakness. Tightness in the hips will cause your front foot to land in a closed position, meaning more, if you're a right-handed thrower, means you're landing more on the third base side, causes your arm to speed up, putting increased stress on the front side of the shoulder and the scapular stabilizers, but most importantly on the medial elbow, the inside of the elbow, the ulnar collateral ligament, the Tommy John injury. It's measured in the lab that ligament can only take certain amount of forces. Well, the amount of force that occurs when a baseball is thrown above 85 miles an hour is almost twice the amount of force that ligament could stand under stress and pressure in a lab. So you can see how important it is for the other muscles to be coordinated and strong, because the elbow itself cannot handle the load of throwing a baseball. I was at one course that talked about the number one risk factor for an elbow injury, Tommy John surgery, is throwing the ball above 80 miles an hour. Most of these athletes, when they train today, when they want to go beyond the high school level or even the high school athlete, their goal is to throw 80, 90 miles an hour. And velocity becomes their biggest goal. Oftentimes the college coaches, if they plan on going to college, they're worried about velocity. The professional scouts worried about velocity. Unfortunately, velocity will lead to injuries. You need it to play beyond, but you better be getting your velocity from the entire body working and not just from the speed of the arm. Landing too open, the arm will lag behind as opposed to speeding up, again, putting extra stress on the inside of the elbow. Tightness of the hip and knee will also limit the amount of stride length and to land in the proper position. You want to land going to the plate. Your stride wants to be roughly equal to your height. So obviously if you're 6 foot, you want about a 6 foot stride length. That's kind of the rule of thumb. Weakness of the rotator cuff or scapula, as well as tightness of the capsule and ligaments of the shoulder, will cause improper positioning of the humerus, the long bone of the upper arm, on the glenoid, which is inside the shoulder blade, which acts, if you pictured a golf ball on a tee, if that's not balanced, you're going to cause undue stress and increase your risk of injury. I know this is somewhat unrealistic for the young athletes, the 7 to 12-year-olds. I don't expect a 7-day-a-week schedule, but you literally can work 7 days a week. You want to mix up what you're doing. On the days that you're throwing, it is advisable to do some strengthening. Although the advice says to do this strengthening, somehow my slide went on its own there. So on the days that you throw, we'd like to do the strengthening. We like to do the strengthening afterwards. Stretching and core work, they can be done on your off days, your non-throwing days. Actually, core, I like seeing done every day, but stretching is usually done, a little bit of stretching pre-throwing. It's advisable maybe to go for a light jog till you get blood flowing through your body, probably to the point where you work up a light sweat. Then do some of the throwers 10 exercises, which are a couple slides above this. Instead of doing a whole series of the throwers 10s, you do all the exercises, but you might do one set of 10 of each exercise just to get all the structures, warmed up. Plyometrics I would do off and on, maybe 2 to 3 days a week. And we'll talk about picking certain plyometric exercises to do. Control drills, oftentimes they work on move a little closer, say for a 60-foot mound, they move up to 45 foot and they work on hitting spots. Sometimes they'll put strings where the athlete's trying to hit the strings when they're throwing, just more sport-specific activities. We also do some long toss, which we'll talk about later on. There's somewhat controversy on long toss programs. There's many different ones. Tuesday, Thursday, Saturday, you do some lower extremity strengthening, some cardio work. Old school people always ran distance. Some of the newer school people tend to think that baseball is a more explosive sport and sprinting may be more of an apt exercise for an explosive athlete. Still, you want a good cardio base, but to run 5 miles, you're never going to need to do that in a baseball game. But you want that base of strength. Cardio, I would say in the off season, get all the cardio you can, but in season, you want to work on explosive forces. Core stabilization, we'll talk about some of those exercises. Stretching of all the extremities. Rotator cuff and scapular strengthening. I can't emphasize enough. I keep saying it over and over, but it's so important. And when I treat injuries, I'm seeing so many of problems in that area, and almost every shoulder patient has scapular weakness. For the youth athlete, if they could get a couple days a week of doing some things preseason, maybe 3-4 days a week of doing some things, maybe a little less computer time and a little bit more outdoor time would do them a world of good as far as being an athlete. I know they're playing for fun, but you don't want to get hurt because then you can't play and you can't have fun. Volume of training, I'm not going to get into this whole slide. When we're looking at volume, we want to think light resistance, high repetitions, lower weights for the early teens. The prepubescents, as they get a little older, a little heavier weights. But for most rotator cuff exercises, you'll be going from maybe 1 to 8 pounds at the maximum. This slide says 5. I've had some people, the very strong athletes, maybe do 8 pounds, but what happens is your larger muscles like the deltoids will kick in and you'll not emphasize the muscles you're trying to work out. It's never too early to work a little bit of resistance. You just don't want to work out heavy. TheraBands, which I have a couple here. As you can see, these are TheraBands. They can be used in a number of ways, whether we're doing rotations, and I'm going to show you all the pictures. They can be substituted for weights, but light weights and or bands are used by most of our athletes. Stretching, as we talked about, needs to be done regularly. I like to hold my stretches 30 to 40 seconds, 3-4 reps for each body part. Literature says that a low intensity, long duration stretch seems to have more benefit than quick bursts of stretching. Also, before doing some static stretching, we like to do some active stretching. Active stretching is doing some high leg kicks, some straight out leg kicks. I would say go online, look up some of the active stretches, and then once you're somewhat warmed up, so when someone's walking, they can kick the legs out, they can rotate their hips, and then get more into the traditional stretches of bending, twisting, etc., and holding. Plyometrics, try to pick 3 to 6 of the exercises per session. I'm familiar with a program called the 7 Innings of Hell, and what that involved, it would involve a plyometric exercise such as an overhead medicine ball toss, and you would run and throw a soccer throw as far as you can, sprint to the ball, come back, do it again, throw between 12 to 15 repetitions with that as if you were throwing an inning. Then do some core work, maybe a couple abdominal crunches, some lumbar stabilization, some any type of core work, some planks, some side planks, etc. And then rest 5 to 10 minutes as if you would be in between innings. Then you would go on. The second inning would be another type of medicine ball throw, which may be a side throw. It may be a diagonal throw. And then go through the whole sequence. And they call this 7 Innings of Hell because the athletes were high school athletes at the time, but it can be done up to 9 innings. I know some pretty highly conditioned athletes that pretty much gassed out by the 3rd inning of hell, so to speak. It's a very rigorous program, but highly effective. You're using all the muscles that are used in the pitching world. Plyometrics are explosive muscle movements. See here, here's some stretches. This is the sleeper stretch. You're stretching the posterior capsule. What you have to be careful with this is that you truly have a tight capsule and tight posterior shoulder as opposed to having a bony problem. You don't want to stretch bone into bone. Some therapists out there that I read their literature, they prefer the posterior shoulder stretch like this. This one's done against the wall, pulling that arm across. I like to use the wall because if not, then a person tends to turn their whole shoulder, as you can see me in the screen there. The wall stops the scapula from moving, and you're just stretching those posterior structures. This can also be done. Imagine I'm lying on a table, lying on my side, and doing the same type of stretch. This again, you hold. I prefer the 30 plus seconds, but here they're telling you between 10 and 20 seconds. It's not only my personal preference, but it's what I read in the literature for athletes. These are a series of lower extremity stretches. There's far too many for me to put up slides. Obviously, you're stretching the glutes, which are the large muscles, the low back, the quadriceps, hamstrings, calf muscles, internal rotators, external rotation, rotators of the hip, trying to get everything. There's many out there. Obviously, you can look up all of these. This is just a brief sample. We'll get into the throwers 10 exercises. This is the written description of them. I have some pictures coming up. An upper extremity diagonal flexion and extension is doing rubber bands coming from up here, or you can take some weights coming from up here, going across the body in the pitching motion. Internal, external rotation are these types of motions, and I will get to the picture. This is internal, external rotation at 90 degrees. Can be done with the weight and or with a band attached to the wall, and this band's pretty tough, and you turn your body around, etc. Shoulder abduction is coming out to the side, again with the band. I like to stay below 90 degrees and keep the weights again below 88 pounds. I'll see guys at the gym going with 80 pounds, and I just want to hand them business cards to come in for shoulder treatment. Scaption is movement within the scapular plane, putting the shoulder in a nice position. You can do your strengthening from there, again with weights and or TheraBand. I tend to prefer the weights with that one, but coming down slow is important. You want the deceleration phase to be activated. Prone, meaning on your stomach. Horizontal abduction is basically getting into a T position and reaching to the sky. There's a series of exercises called Blackburns, which also take off this thrower's 10, and they will do this horizontal abduction in a neutral position, which the palm would be facing the floor, and or with the thumbs to the ceiling, activating different areas of the muscles. Chair presses are just what they sound like. You're in the chair, you're activating the serratus anterior, again, stabilizing the scapula. Prone rowing, again, on your stomach would be straight back, retracting the scapulas. Prone rowing with external rotation would come back and then rotate back, which activates the lower trapezius and will put a downward angle of that scapula, giving you a little more clearance of your shoulder. Elbow flexion and extension, everyone knows that they are like this here. Elbow extension, you can do extension like this. There's many ways to do them. Wrist extension, flexion, pronation, and supination. I'll be able to show you a little bit better on the pictures. Basically, it's bending the wrist up and down, rotating in and out, again, using weights. Light weights are, well, push-up plus, I'll show you on the wall. So you do your push-up, you come up, and then you reach out, and then come back down. And these can be done on the floor. They could be done on medicine balls. They could be done on physio balls, you know, the big exercise balls. They could be done with your feet over the ball and your palms on the ground. They could be done on BOSUs. So again, all things to increase the amount of stability that you are attaining. Here's some of the pictures. There's the diagonals, the external rotation there at 0 degrees, internal rotation. The next picture is at 90 degrees, both internal and external rotation, scaption, triceps, horizontal abduction. You know, you can look up all these exercises. Basically look under throwers 10, it'll pop up and you'll be able to print it out and get some better pictures than this. Unfortunately, I couldn't find a whole chart of them. You know, they have the individual exercises, which anyone can print. These are some examples of plyometric drills. We talked about some of them when we were talking about the 7 innings of hell. So you could do some warm-ups, which are basically just taking that physio ball and rotating your body, side bending your body, doing wood chops. Then we talked about the tubing. The PNF pattern is basically a diagonal with the tubing. Again, you can do these quick motions. You can do throwing motions in a standing position. Again, I've seen it go as far as getting into the running and actually doing these throws. A little more advanced, but as the athlete grows, he's going to want to be challenged, and throwing a baseball is an explosive activity. So building explosive ability in your body is important. Throwing with a baseball, one hand baseball throw. So basically you just normal throwing. I wouldn't get into weighted balls right now. There's too much controversy. You are going to increase velocity, the literature says. There's been some recent studies, but you're also going to put some increased stress, and your risk for injury grows up. Without a doubt, you are going to increase velocity. Anybody that's advertising is going to tell you to increase velocity. They're going to show you examples of people who've increased velocity, but they're not going to show you the people that have been injured. I have personal experience with that. My now 30-year-old son threw a baseball pretty hard. He's a 6'8" man, and he did weighted balls for a while. He also threw year round. He also threw long toss. He ended up with Tommy John surgery, and he never was quite the same after Tommy John surgery. So again, I don't believe every athlete's going to be 100%. If they're professionally trained, they're going to get therapy every day. They're going to be stretched every day. The odds of them getting better are much higher than the regular high school athlete that's going to do these things. But again, we can talk about weighted balls, and there are some benefits, but some of the methodology of what they do is not out there proven in the literature. And there's a lot of Dr. Andrews and Kevin Wilk out of Alabama have done a number of studies recently, and all of those things can be looked up and get your own opinions. But my opinion is I would probably not do most of the programs that are out there. These are just some more medicine ball workouts, a whole series of them. As you can see, there's many within a workout. As I said earlier, pick 3, 4, 5 of these exercises to do on a given day that you're doing plyometrics. Planks, side planks, one-arm planks, planks on balls, planks with movements. So you could do a side plank. You could kick your leg out to the side. You could lift your arms and legs together. You could get TheraBands, move them. You could get physio balls, do an internal rotation while you're in a side plank. Doing other movements while you're engaging your core translates into some of the movements that you're going to do on the field. Again, there's dozens of exercises for the core, many of them traditional, others a little more exotic. Find the ones that work best for you. Again, core work can be every day. Those muscles are constantly working, even just when we're walking, sitting. A good core is going to lead to overall better health, not just be a good athlete. Interval throwing program after injury is a little different than if you didn't have an injury. And some of the differences are really how many days in a row you throw. Some people need more days than other days. There are charts, and let me go 2 up and I'll show you a chart. And here's an example of phase 1. The person is starting at 45 foot, throw about 10, 15 warm-ups, really light tosses. You're going to use a crow hop when you do these. A crow hop is not throwing flat-footed. You're going to take a little run. Most of you in the audience, I'm sure if you're watching this, know what a crow hop is. So you're going to throw from 45 feet at a nice, comfortable intensity. Rest 5 to 10 minutes. Another warm-up throwing, another 45 feet, 25 throws. If there's pain involved in any of this, you shut it down. Give a day or 2, come back, try again. This, again, should be monitored by a professional. But if your doctor says, some doctors, general practitioners will just tell their athletes, okay, just go do a throwing program. So the youngster goes home, reads this, and goes from phase 1 to 2 to 3, and they just keep moving along, and they don't modify based on their symptoms. I'm going to go back to that. So no pain or stiffness with throwing, no pain or stiffness after throwing. All throws should be effortless. You don't want to strain. You just want to throw. You want to stretch that arm out. You want to use that arm, get the muscles re-educated to working again, especially after injury. The rest periods are different and they vary. And again, professional guidance will take you through that. And you should not be sore to move on to the next phase. Again, you could get into a point where most of the programs will take you out to 180 feet for the rehabbing athlete. And at that point, they start doing some flat ground, mound throwing, not flat ground, mound throwing. And again, it goes through a sequence of events. An interval throwing program without prior injury, you may not have the lengthy rest periods. You may not have the same amount of days between. As we talked about earlier, we want the short jog, some light tubing work and stretching. Pro hop we talked about. And you don't have to throw it on a straight line. You want to get a little bit of an arc in your throw as you're rehabbing. You're not looking for velocity right there. You're looking to rehab that arm. Avoid flat footing, which kind of repeats itself on the crow hop method. Whereas we talked about the athletes starting at 45 feet, the difference little leaguers starting at 30 feet, and they probably end out at about 90 feet as opposed to the 180. I talked about the older athletes. All of this can be found. It's widely available on the internet, these throwing programs. Most of your youth athletes are going to go with, hopefully they're healthy when they're starting this. Hopefully it's not after an injury, because if it's after an injury, they're going to see someone like myself, and I'm going to be advising them and giving them handouts of these programs. That's the one we looked through already. In conclusion, as we said over and over and over again, we want to get power, we want to get strength, we want to get flexibility of the shoulder, the scapula, the core, the lower extremities, all this to enhance performance. But in my mind, more importantly, to prevent injury. Limiting that playing time 3 to 4 months throughout the year will allow for proper rest. Playing multiple sports will avoid repeated stress on the particular body part. Again, I go back to my son. He was in an era where everybody was saying you needed to play baseball all year round. He threw the ball 90 miles an hour. Everyone said he was going to be a pitcher, needed to play baseball. Well, he was 6'8". He probably should have played basketball. Probably could have played football. They would have prevented some of that overuse experience. I hate to go rate the personal experience, but it's what keeps me involved and interested in these injuries, because I've seen many kids I've coached either drop out because injury or just stop playing because the aches and pains without a serious injury, but they just don't think it's worth it. Then getting into a proper return to throwing after injury or prolonged rest will help avoid injury or re-injury. At this time, I'd like to thank everyone. And if there's any additional questions, you can email us at mbortho.com. And I believe we will be taking questions right here on the program. Let's see, I do see a question here. I have a question. Can I explain long toss? Long toss is meant to be stretching out of the arm. Most of the programs start out with a short catch, and you extend 5-10 feet with each throw once you've been warmed up. And some of the programs out there want you to get out to a maximum distance without pain, without excessive effort. And then once you get out, they have what they call a pull down phase, where you start coming in 10 feet at a time, and you're throwing more like the pitching motion. You're trying to keep that ball on a more level plane. The going out portion of the long toss, there's more of an arc, but again, there should be no strain with this. The distances are where the biggest problems are. And again, there's people that throw 300 feet. Someone like Trevor Bauer, major league pitcher, he's been known to get out 340 feet. He's an advocate of Alan Yeager's long toss program. There's some good and there's some bad. It's really individualized to the athlete. So I have a question here. Do I offer professional assessments that have been described? We at Mercer-Bucks would like to get the athletes to come in for a full assessment of the range of motion, the strength, all the things we talked about. And yes, we do offer that. It would have to be set up by appointment, but I would highly advise it. Most of these athletes, again, we don't see till they're injured, and most of them have deficits and they're playing all season long. So the injury is almost going to happen. It's not if, it's when.
Frank, I just want to thank you for a really great webinar. It was very informative. I'm sure a lot of people are happy to have listened to all the interesting facts you had about these young athletes and how to help them prior to them getting injuries. So I am just going to launch a quick poll, as I was telling you at the beginning of the webinar. If you just take a few seconds to fill that out, it's just a couple questions. It just allows us to better understand what you're interested in learning about in the future. And again, if you need anything, certainly give us or send us an email at programs@mbortho.com. We appreciate you joining us this afternoon, and we look forward to seeing you soon. Thanks.